Welcome to The Explainer. Today, we're jumping into a huge topic for AQA A-level psychology, and we're going to tackle one of the most fundamental questions out there. How do we actually figure out what abnormal even means? So, what actually makes a behavior abnormal? It's a real challenge for psychologists because, spoiler alert, there's no single perfect answer. That's why they've come up with a few key frameworks to help get a handle on it. Okay, here's how we're going to break it down, and you'll see this lines up perfectly with your exam paper. We'll start with the core knowledge you need for AO1, then look at how to apply it for AO2, and we'll wrap up with that all-important critical evaluation for the top AO3 marks. Sound good? All right, let's get started. Time to lay the foundation and lock in those crucial AO1 marks. We're going to cover the 4 key definitions you absolutely need to know. First up, we've got statistical infrequency, and this one is pretty much all about the numbers. The idea is super simple. If a behavior is rare, it's considered abnormal. Think of a classic bell curve. Most people are clumped in the middle, right? Well, this definition says abnormality is way out on the extreme edges. And this is where it gets interesting. On one hand, this definition is really useful. It's objective, it gives a clear statistical cutoff, which is great for things like IQ tests. But here's the massive limitation. It doesn't care if the rare trait is good or bad. I mean, having a super high IQ is statistically infrequent, but you wouldn't call that a disorder, would you? Okay, next up, deviation from social norms. This one is all about fitting in. It basically says a behavior is abnormal when it breaks the unwritten rules of a society. You know, those things we all just know you shouldn't do, like standing way too close to a stranger or shouting in a quiet library. And right here, you can see the biggest problem with this definition. It's something called cultural relativism. Sure, it helps us understand what's expected in a particular place, but what's normal in one culture can be totally abnormal in another. It just doesn't work universally. All right, let's switch gears to a more personal point of view with failure to function adequately. See, the focus here shifts away from society and onto the individual. The big question is this person's behavior causing them distress? Is it stopping them from coping with everyday life, like holding down a job or keeping up with their relationships? Now, this is what makes this definition so powerful. It actually acknowledges the patient's own experience, their own suffering. It's not just about what other people think is weird, it's about whether the person is genuinely struggling. And that gives it huge real-world applicability in a clinical setting. And finally, we have deviation from ideal mental health, where a psychologist named Jehoda completely flips the script. Instead of focusing on what's abnormal, she decided to define what's normal, or, well, ideal. So with this one, abnormality is just not meeting that list of ideal criteria. Now, this is a really positive, holistic way of looking at things, which is great. But man, are the standards high. I mean, think about it. Who do you know that has super high self-esteem and can resist stress all the time? By this definition, most of us would be considered abnormal. And, as we'll get into later, it's also criticized for being pretty heavily based on Western individualistic ideas. Okay, so that's the AO1 knowledge banked. Now let's put it to work and see how we can score those AO2 application marks. We're going to look at how these frameworks actually play out in real-world scenarios. So, let's take diagnosing intellectual disability disorder. The statistical infrequency definition gives clinicians a really clear objective starting point. An IQ score below 70 is a hard number, right? But, and this is key, that number alone doesn't tell the whole story. A clinician has to combine that with an assessment of how well the person is actually functioning in their day-to-day life. And here is a fantastic example of that cultural relativism problem we talked about. If you rely only on social norms, you can get into big trouble. In many Western cultures, hearing voices is a major symptom of schizophrenia, but in some African and Asian cultures, it can be seen as a spiritual gift. This is a perfect point for your evaluation, hitting that grave criteria of generalizability. This definition just can't be generalized across cultures. Okay, this is a brilliant link you can make in your exam connecting to the psychopathology topic. When we apply failure to function adequately to understanding depression, it helps us see the symptoms in a new light. A student missing lessons isn't being lazy, it's a sign that their psychological distress is making it impossible for them to cope. It reframes the behavior as a genuine inability to function, not a character flaw. And look at this, another great link, this time to the approaches topic. Jehoda's definition isn't just about spotting problems, it actually gives a positive goal for therapy. Her idea of self-actualization lines up perfectly with Maslow's hierarchy of needs from the humanistic approach. So the therapy isn't just about fixing what's broken, it's about building towards this ideal state of well-being. All right, time for the really juicy part, the AO3 evaluation. This is where you get the top marks. Let's dig in and weigh up the strengths and weaknesses of each framework to sharpen up those critical analysis skills. Okay, this table is basically your cheat sheet for revision. It lays out the main strength and weakness for each definition, side by side. And you'll notice I've highlighted some key terms. These are your best friends for evaluation. They come from the GRAVE acronym: generalizability, reliability, applicability, validity, and ethics. Dropping words like reliability and generalizability into your essays is going to make your arguments so much stronger. Let's double-click on this problem of cultural relativism, because it's a huge AO3 point. It hits two of our definitions hard. For deviation from social norms, what's deviant is totally dependent on the culture. And for ideal mental health, Jehota's focus on things like personal autonomy and self-actualization, those are very Western, individualistic values. The bottom line, both of these definitions seriously lack cross-cultural validity, and you can't generalize them to everyone. So, where does that leave us? What's the final verdict? Well, as we've seen, every single one of these definitions has some good points, but they also have some pretty big flaws when you use them on their own. The real secret is in putting them all together. And this right here is the absolute key takeaway. This is the big conclusion for your essays. In the real world, no single definition is ever enough. A good clinician uses a combination of them. They look at the statistics, sure, but they also look at the social context, the person's own distress, and their overall well-being. It's a multi-dimensional approach. And that really leaves us with one final big question to chew on, doesn't it? If abnormality is this complex mix of numbers, culture, and personal struggle, then what does normal even mean? You see, by digging into how we define abnormality, we're not just prepping for an exam. We're actually getting a much deeper, more nuanced appreciation for the incredible, messy, and wonderful spectrum of human experience.